everyone! It's me again, Alona, your lactation consultant. I'm back! So, panibagong tanong na naman, a nanay messaged me privately at nagtanong, after 2.5 years, nag-quit na siya ng breastfeeding. Kudos! Yay! Could you imagine, naka 2.5 years siya? Ako naka 2 months lang ako ng breastfeeding ko before, 26 years ago. So, I salute you, mommies na nag-breastfeed 2 years and beyond. Could you imagine? It's such a big savings. It's just a big bonding. Could you imagine? Those are 2.5 years na nag-breastfeed. The problem was, she messaged me. Magang-magang at sakit na yung breast niya after 3 days na nag-quit siya ng breastfeeding. Then she messaged me and she was asking anong dapat inumin, anong dapat igamot, dahil masakit na masakit, anong gagawin. And I know I did this video before on what to do after you quit breastfeeding. I-repeat ko lang ito, some of the ideas, para you will be refreshed. Maybe a year or 2 years from now, you want to quit breastfeeding because it's gonna happen na napakasakit. Okay, so these moms really struggled because marami pa siyang gatas. Even 2.5 years, marami pa siyang gatas. So she was asking advice, anong gagawin niya, ang sakit-sakit, hindi siya makatulog, hirap na hirap siya. So, again, uulitin ko because I have new subscribers right now. So this is for the benefits of my new subscribers who probably you never seen that video that I've created before. Now, when it comes to weaning or quitting breastfeeding, dalawang papupuntahan nyo, okay? Either your milk after 2 or 3 days dry out right away. May mga nanay na ganun eh. Or either 3 months, 6 months, or even a year, hindi pa rin nagda-dry out yung milk nyo. Okay. So, again, every woman is different. Now, we're gonna focus on the severe engorgement after you quit breastfeeding. Dahil ito ang para kang pinarusahan ng ilang araw when it comes to weaning breastfeeding. So, dito sa sitwasyon na to, ang pinaka-worst talaga mga 3 days. Kasi doon talaga mapifeel mo itong breast natin, naninigas na yan. And you know how it looks like? Because I experienced this. Kumikintab na to. This was like, yung skin ng breast become very shiny. Kasi na-expand na-stretch na talaga yung buong skin. So, believe me, when I say, so if this is a cup D size of breast, it may double D or triple D when you quit breastfeeding. Ganon ka-severe minsan pag talagang punong-puno na yung breast mo sa milk after those days, 3 days or 5 days. The pain was enormous, like yung sakit minsan talagang gumagano na yung mga daliri ko sa sobrang sakit. Every time I lay down to my side, so natatouch sa side ng bed ko, umaaray ako sa sakit kasi sobrang sakit, nilalagnat ako. So this is the true normal effect when you quit breastfeeding. So the only way you can lessen the pressure here is to put the cold compress. May ibang mga healthcare providers na sasabihin, put the warm, let it leak. Pag nagli-leak ang milk means nawawala ng pressure. When you put that warm, yes, nagli-leak yun because it will trigger letdown, right? But yet, you want to stop it. So ang ginagawa ko, it's always good. Send your husband to the market, get the biggest cabbage, yung cabbage repolyo. Make sure tanggalin mo yung mga malalaking leaves. Ilagay mo sa freezer, maybe 10 minutes, 15 minutes, para ma-cool na cool talaga, and then put it there. You can change it maybe every hour, kasi nagwa-warm up na to. Mapifeel nyo, alam nyo ba mapifeel nyo? When you put that cabbage leaves, mga within 1 hour, parang naluluto yung dahon ng cabbage leaves. sa breast nyo. Kasi mainit eh. Because it's inflamed. Ang breast natin, pag nag-quit tayo, nagiging inflame yung mga ducts na stretch inside. So, yung leaves, naaalala ko talaga yun before. I have 2 big cabbage leaves sa breast ko, and then after an hour or 2, ano bang tawag nito? Parang naluto yung cabbage leaves sa sobrang heat doon sa inflammation. So again, yun ang tinuro ko sa nanay na yun. After a day, I messaged her, sabi ko, masakit pa rin ba? Masakit pa yung isang side, something like that. So sabi ko, continue putting the cold pack. Kung wala kayong cabbage, get a face towel. Basain nyo ng tubig, ilagay nyo sa freezer, mga, again, 10-15 minutes, tapos ilagay mo yun in cool na cool. Pag medyo mainit na yung towel, put it again in the freezer, okay? Kung if you have ice cubes or whatever ice pack you have, put it in there, i-wrap mo muna ang konti ng paper towel or towel para hindi talaga directly into the skin. So, put it there, okay? The number one thing that you really have to prevent when you have this severe engorgement after you quit breastfeeding is never touch your breast, okay? Never. Kasi konting tingling stimulation doon sa breast mo, mag-trigger na naman yun ng letdown. Lalong masakit. We don't want that. So make sure you prevent the movement. What our advice sa clinic namin is if you can wear your bra, wear a bra na itatight mo ng konti para hindi magyuyug-yug yung breast mo. The movement would really create another letdown, another stimulation, and we don't want that. We want to stop the stimulation, we want to stop the milk. So, you may be asking, hanggang kailan ka magtitiis? Because again, it may take 3 days, it may take 4 days, it may take 2 weeks. You never know. But it will slowly dry it out. In my situation, dahil hindi ko na talaga kaya sa sobrang sakit, I went to see the doctor at binigyan ako ng gamot to really stop the milk. Okay? Ewan ko kung meron kayo dyan sa gamot na yon. I can't remember kung anong gamot na yon. So, always remember, there's always a way. Do the natural way by putting ice pack, cold pack, whatever you have. Ang payo namin dito sa mga pasyente namin sa breastfeeding clinic namin, you can take over-the-counter medication para sa sakit na ulo, para sa pain, para sa inflammation, ibuprofen. Ask your doctor kung gusto nyo talaga ng medication na totally talaga mag-dry out yung milk nyo. But take note, there's always side effects in anything you take when it comes to medication. So always be aware. Basahan nyo talaga kung anong mga side effect ng gamot na yon. Minsan kasi may mga gamot na ang side effect, sakit naman ng ulo, or stomach cramps, or diarrhea. So you have to make sure na binabasa nyo yung mga side effect ng mga gamot na iniinom nyo. For moms na you're still breastfeeding right now, and maybe after a year or so, plano nyo nang mag-wean out kayo dahil you're going back to work, or you just think like you have enough, make sure you do your research. Watch the videos that I have created in the past dahil marami kayong matutunan doon kung anong gagawin nyo, okay? Make sure lang na pag nag-start kayo ng quit ng breastfeeding, okay? You have to prepare kung ano yung gagawin nyo with your baby when it comes to feeding from the bottle or from sippy cup or whatever feeding tools na gagamitin nyo pa after when you quit breastfeeding. Kasi pag quit ka ng breastfeeding ngayon and then hindi ka prepared, miserable ang buhay mo, miserable din ang buhay ng baby mo. Iyak na ng iyak, hindi malaman kung anong gagawin because you're not prepared. You always have to be prepared what you can do. Anong gagawin mo pag nagwawala si baby? Do you have anything to offer na mag-calm down si baby? When it comes to solid food, are you prepared na ihahalo yung formula doon sa food ni baby? Anong klaseng formula? Things like that. You need to prepare and plan. Or mag-stash ka na maraming milk ngayon bago ka mag-quit para makatipid ka sa formula. Things like that. Dahil alam ko ang mahal ngayon ng formula. And then if you quit after a year or so, then hindi ka prepared financially to buy formula. How can you manage feeding this baby? Maapektuhan yung weight ni baby, maapektuhan yung health ni baby if you're not prepared. So preparedness is what you really need when you are ready to wean off or stop breastfeeding, because it's gonna be a miserable few days journey with you and your baby having this problem na the baby is just screaming for your milk and you have nothing to offer, or you don't know how to comfort your baby. So things like that. Make sure na aware din yung mga kung sino kasamahan sa bahay mo, mga in-laws mo ba, or dahil itong baby na to, iyak ng iyak para siguro every hour tuwing nakikita ka. So be prepared, mommy, dahil it's a miserable journey when you do this. Believe me. So, thank you for somebody who asked me this. I know who you are. I know you always watch my videos. Maraming salamat sa mga bago kong subscribers. As I've mentioned before, I will always make sure na may reliable videos kayo from me, from your lactation consultant na matutunan nyo, because it's not easy being a mom struggling with so many problem when it comes to bottle feeding or breastfeeding. So I'm here. Do your comments. You can message me privately if you want to. I want to know kung sino may naka-experience na ganitong experience. Share the joy, share the journey, and see if we can learn from each other. So thanks again for watching. I know for a fact na someday siguro magkikita tayo, because as I've mentioned in the past, a few days ago, that I will be coming to the country and doing breastfeeding workshop sa mga provinces that nag-organize ng mga events or conference for me, so that I can help more healthcare providers, mga nanay, or mga families who really need help. And sa mga estudyante who really struggling with your research and thesis, watch my videos, because I'm here to help you and guide you when you're doing your thesis, especially this coming school year. So mga nanay, mga estudyante, ang inyong lactation consultant and educator will be coming to see you. Hopefully, someday, makapag-organize tayo ng magandang event, and then I'm gonna be there to help you all when it comes to breastfeeding problems. So again, thanks for watching. Take care of yourself. I know breastfeeding is not the easiest thing to do, okay? Not everyone, not all moms are finding it easy. It's not easy. It's gonna be easier. Easier pag it's medyo established ng mga plano nyo at mga when you're well prepared. So again, maraming salamat for continued watching my videos. Someday, again, baka magkita tayo. Bye for now.